Hi, my name is Eneh Jones-Odeh, and I am a doctor. I'm also an image consultant and personal stylist. And I've been doing medicine for, 14 years now, which is very interesting, actually. It doesn't feel that long, but it's gone by really quickly. And I've been doing personal styling since the pandemic.
So what does the name Eneh mean?
People don't actually ask that most of the time, but it means mother. And I'm not a mother yet. So for me, it gives me hope for the future. It's something to look forward to. I am excited about what I will be like as a mum. I do have 2 nephews, and I see how my sister parents them really well as a mother. And I actually learn a lot from her. But yeah, my name means mother.
And okay, so what's the best advice, Eneh, that you think you've ever received?
Oh, wow. The best advice I've ever received. There's a lot. I would say from a faith perspective, I'm a Christian and I believe in God. So I think the best advice I've received in life is to put all my faith and all my trust, my identity in God, not in my job, not in my work, not in my title, not in my looks, not in money, not in anything. So I would say that's been the best advice, to have a sincere, true, and intentional relationship with God and seeking Him first in every area of my life.
And what decision most changed the trajectory of your career, and what's helped you make it more confident?
Oh. So the decision that has most changed the trajectory of my career would be changing career paths within medicine. So I previously trained as an eye surgeon, and I worked really hard towards that from medical school, did 2 years of general medicine, general surgery, and then did a year of research in eye surgery to be able to get a job in eye surgery, which is very competitive in the UK. So usually, at the time, it was one of 90 jobs in the country. And I was really excited at the time to get that post. And I enjoyed eye surgery. I loved it. You basically got to work with lasers, with microscopes. You got to do really cool surgery with people awake, and you made a significant difference to people's lives by restoring their vision or preserving their vision. So I changed jobs from eye surgery to occupational medicine, mainly because I found the other aspects within eye surgery quite exhausting. We had long hours, very long on calls, and I was away from family at the time. So I was in Cornwall and in Devon, and my family are in the southeast of England. So separation from them and also feeling burnt out, actually, if I'm being honest, did, inspire me to make the change. However, I would say, even though it was a difficult decision at the time, it was very hard, I feel like it was the right one for me to make. In terms of how that decision has increased my confidence, is I've been able to just trust my decision making and trust that I made the right decision for myself at the time. A lot of people questioned whether that was appropriate, or, giving up a job that I worked really hard to get into was the right decision, and maybe just sticking it out. However, it actually opened the door for me to specialize in another aspect of medicine. So I was able to widen my skills, but also it challenged me to start my business as a personal stylist and an image consultant. So prior to the pandemic, I would do that informally for friends, for family, relatives, and I really enjoyed it. And during the pandemic, I had some time to reflect and just think about doing something outside of medicine that was creative, that would be fun for me and not feel like work, but will also impact people's lives positively and also help build their confidence as well. So I would say those are the main reasons.
Very interesting. So, like, what misconception would you say that people often have about your job, especially at the level that you're at?
Well, interestingly enough, I would say the first misconception people have about me as a doctor is that I'm a doctor, which is very weird. They're like, "You're a doctor?" And sometimes patients ask if you're a doctor, which is it's like, yeah, I'm a doctor. It's okay. But I think in my current career in occupational medicine, people don't actually understand what that means unless they've had to see a doctor for a medical condition that can affect their ability to work. So basically, that's what occupational medicine is. So it's assessing a client or a patient and examining them and writing a report about how their medical conditions can affect their ability to work, and then making recommendations to their employer about what can be done to support their return to work, or whether they're fit to work or not fit to work. So I think people can have some misconceptions about you being the one in control of their job, which is not necessarily the truth. However, you want to support people in their journey and help them the best way possible to be able to keep their independence, to be able to keep their jobs and to remain financially free. So I find that part of the job very exciting, and you feel like you're really making a difference to people's lives in a tangible way.
You look like a superstar, though.
Oh,
really
thank you.
All right, so what skill, of all the skills that you learned over your career, which skill would you say has had the highest return of investment?
Oh, so the skill I would say has had the highest return of investment is communication. I think communication is necessary in every aspect of your life, in whatever relationships you're in. So be it with a spouse or partner, family, friends, and especially in the workplace. As a junior doctor, I learned very quickly that bedside manner, as they say, is essential to a patient's experience. It really makes a difference to a patient how you relay information to them, whether that is good news or bad news, using terms that are not too complicated for them. So avoiding medical jargon and breaking things down in a way that they can understand, and they can also have some autonomy in how their conditions are being managed. And also it helps the patient and the client partner with yourself in treating them appropriately and not avoiding responsibility on their side for managing their conditions the best way possible, but also it doesn't feel like they're completely excluded from the process of their medical decision making. Also, with my colleagues, communication is essential. Basically encouraging them in works that they're doing. If they're doing a great job, just a nice, well done, you did a great job here, you spoke really nicely here, or you handled this situation which was really difficult very well. And even in training, I've been involved in training in my current job with new starters that join the business, and I find it very rewarding to be able to mentor in a way the new starters that join and help them along their journey in passing probation and in settling in nicely into the business. So I would say communication skill is a massive, skill that needs to be continued to be invested in, actually. It's not something that we'll be completely perfect in, but if we're intentional about practicing it and intentional about ensuring that it's something that we do on a day-to-day basis, then yeah, I think it will continue to bring a massive reward on investment as well.
Awesome. So, like, what is your approach to setting boundaries without hurting people's feelings?
Oh. So my approach to setting boundaries without hurting people's feelings is putting myself in the other person's shoes and speaking to them how I would want to be spoken to. I believe that boundaries need to be set in life because you have to protect yourself, protect your energy, not in a fearful manner, but in a manner that helps you to continue to present yourself in the best way possible in every aspect of your life. And if boundaries are not set, then the chances of you betraying yourself or betraying your character is very likely. I think setting boundaries is harder with people that you care about because you understand that a lot of the time they're probably not doing things out of malicious intent, and they are not aware that certain behavior characteristics might affect you in a certain manner. So you have that at the back of your mind and you try to take that into consideration. However, sometimes if it's not addressed, then repetition of such behaviors will continue to have a significant detriment on yourself. So I try to set boundaries initially by not doing it in the heat of the moment, because I don't think that helps. I think things tend to escalate when that's done, and I've learned from experience. And it doesn't mean I get it right all the time, but I believe that talking in a calm tone, using words like, this is how you made me feel, and this is how your behavior affected me, rather than using pointing or accusatory words like, you did this, you always do this, you never do this, things like that, which can make another person unwilling to hear what you're trying to say. I believe that using words about how you felt as a result of their behavior, and also expressing the possible consequences of their behavior, is essential. Having that difficult conversation saying, I don't like how you made me feel here because it made me feel angry, it made me feel sad, it made me feel disrespected, or that you didn't care about my feelings. I understand that you probably didn't mean it in a way to hurt me, but it did hurt me. And I'm talking about this to you so that we don't have to, go through this process again, and we don't hurt each other's feelings. You don't hurt my feelings, and I understand you a bit better as well. But also that if the behavior does keep happening, that it might affect the relationship, whether that be the closeness of the relationship or whether that means the relationship continues at all. So it can be hard, especially with those that you're close to, like family, because you can't really end your relationship with family. Although sometimes, depending on what's been done, it might necessitate that. But I think it's important to always be clear in your boundaries, but also say it in a loving manner. It doesn't need to be in a derogatory manner. It doesn't need to be in an accusatory manner. However, sometimes it might also need to be firm, just so that it's well understood that it's a significant boundary.
So what's a moment of failure that you don't want to see on camera that I guess was a setback that you were glad happened, and what did it teach you?
I guess initially I didn't think this as a failure, but the switch from eye surgery to occupational medicine could have been thought of as a failure. However, I'm still glad that I did it. I expected that I would have remained as an eye surgeon for the rest of my life, travel abroad and do surgeries abroad and work in charities and things like that, which, those are good things. But in the moment, and facing burnout and realizing that actually this is what I thought I wanted, but it might not be what I want to continue with at the moment. And it was a hard decision and it kind of felt like I was giving up. But I am still glad it happened because I feel like it has forced me to learn that life needs to be flexible, that things can happen, that those things don't define you, especially your job. It does not mean that you shouldn't work hard or you shouldn't do your best as well as you can. However, it forced me to really solidify my identity as a woman in God and soling that rather than in my career or in what I'm doing or what I aspired to do at the time. I would also say I'm glad that what seemed like a failure turned into something that challenged me to start a business, which was completely out of my comfort zone, because medicine, you just get on with going to the hospital, going to your clinic, seeing your patients, and you can start a private business with medicine, obviously, but that was just not on my, it wasn't in my plans at the time. So that challenge to do something creative, do something that I necessarily wouldn't have thought of initially, and I've just continued styling people for fun, but making it into something that was tangible and widening my mindsets, basically. I would say that it was worth experiencing that.
Cool. So, how do you decide what to stop doing, and especially when you're overloaded? What is your technique? What's your
So, how I decide what to do or what not to do when feeling overwhelmed or when I have a lot on my plate is prioritizing urgency, basically. I have to step back and have a think about what is pressing at the moment and what is important or most important, because there are so many things that will always need doing. And I think that's just life. There will be things that will be thrown at you from people. Life will throw things at you that you don't expect. And work, relationships, all of those things, they all have demands on you. It's actually quite interesting. Might be a little bit of a long story, but I heard a talk about prioritizing, and a guy used an analogy of a glass jar, and he was teaching some students, and basically he filled the glass jar with golf balls and asked the students, is the jar filled? And they said yes. And then he poured some gravel into the glass jar, and the gravel sat amongst the golf balls. And he asked them again, is the glass filled? Is the jar filled? And they said yes. And then he poured some sand into the jar, and the sand settled in between the gravel and the golf balls. And he asked again, is it filled? And they said yes. And then he poured water into the jar, and he asked again, and they said obviously it was filled by then. And the point of that story is that the golf balls are the essentials in life. So your family, your relationships, for me, your relationship with God, your work to an extent. So those things need to be prioritized in life, because those are your fundamentals, that they keep you going. Your family, your friends, your relationships, they keep you going. And then the gravel is things like, oh, I need to go out for so-and-so parties, or I need to get extra lots of money, or I need to, what else can I say now? I need to do like this trip or that trip. Not that exploring, hobbies isn't a great thing, but there's always going to be something that you can fill your jar with. So, and it doesn't mean that you can't fill your jar with some of those things. But if you remove all the golf balls and then you pour sand or water into the jar will still be filled, but it will be filled with things that are not important and that are not going to add value to your life, and you will not be able to add value into people's lives that way as well. So that's the way I think about priorities, basically.
Okay, that's brilliant. That's a really great example, actually.
Thank you.
So, like in your current season of life, what does success look like to you, and how would you define how it's changed over time?
So success to me is being content, and that can sound very cliche. It doesn't mean that you shouldn't aspire for more, and it doesn't mean that you should settle for less. But for me, it's being content with where you are, but aspiring to still be better. So I can be content in my career at the moment, but I can still plan ahead to do better, to learn a new skill, to widen my skill sets, to possibly start a business from a medical side of things, from a medical perspective, if that's what I wanted to do. Success also means having healthy relationships. Healthy relationships take time. They take intentional behavior in terms of creating quality time, creating space for engagement with people that you love and you care about, and being present in those people's lives. So success can sound like having loads of money. I mean, it would be nice. Who doesn't want loads of money? But unfortunately, over the last year or so, I have lost, one of my close friends lost her mum, and also one of my close friends has been in hospital for a really long time after being very unwell and needing extensive hospital stay in intensive care. And when you see the fragility of life, it forces you to redefine what success is. Because at the end of the day, when you leave this earth, you don't take any of these things with you. You don't take the money with you. You don't take your title with you. You don't take your properties with you. You leave behind a legacy about how you made people feel. That's how people will remember you by. And so for me, it's being cognizant of, again, I guess going back to priorities, that am I prioritizing the things that need to be prioritized appropriately? And am I leaving a lasting impact that's going to outlive me? So am I pouring into the younger generation? So I mentor girls in my church and have mentored over the years. I believe that having an opportunity to shape someone's life for the better is such a privilege, and it actually allows you to pour into someone else, and you just don't know how your relationship with them can positively influence the trajectory of their life. So for me, success is making impacts wherever you are, but not negative impact, obviously. Positive, lasting impact that can outlive you, and that can also be passed on to the next generation as well, because just as you pour into the generation, they will pour into the generation after them. So the fruit of that is exponential. And for me, that is so important, because I've benefited from being mentored. I've benefited from people pouring their lives into me and taking time to teach me, to correct me in love, to challenge me, to grow. Yeah, that's my definition of success.
So is there a book or a person or resource that has shaped how you think, whether it's your career in medicine, styling, or just you as an individual?
Okay. Well, someone that has, I would say, has shaped me as a person, and I always say this, and she might be quite shy hearing it when she hears it, but she is Tarshish. So she is my friend, but she was initially my, I guess, spiritual mentor or discipleship partner. She's also friends with Sade, your wife. And I think all of us will only have positive things to say about her. I met Tarshish when I was in university, my third year, and I was, I guess, struggling with my relationship with God, trying to understand what that looks like tangibly rather than hearing it from other people, and what that looked like for myself independently growing that relationship with God. And I was not confused about wanting to be a Christian at the time, but I needed guidance, I guess. I'd been praying about it, and she just approached me one day in church and said, "Oh, I would like to disciple you." And I was like, okay. But she discipled me for, I think, a few years, and we became friends after that. But I know for sure that if she hadn't poured into my life, I would not be the person I am today, especially in my relationship with God, which is, my foundation for everything. So I will forever be grateful to her. And she also just led by example and spurred me on to engage in mentoring and discipleship of younger females as well, and empowering them in life, in work, in career, in studies, but also in their relationship with God. She not only taught me things from a biblical perspective or as a Christian, she taught me relational skills. She taught me how to listen when it's hard to hear what the other person is saying, and how to respond when someone expresses either disappointment or frustration because of something that you've done. She just taught me so many skills that I still use today to foster healthy relationships with friends and family. And she still provides time, and she still makes time to speak to me if I need advice for anything, or if I need to rant. And she does that without judgment, and she corrects gently and in love without judgment. So she's definitely one person that lasting impact on my life. I've been leading service as well, which has been interesting because they've been getting me to do that a bit more. Yeah. So, that's been quite nice. Learned a lot.
Predominantly kind of black church? Is it multicultural?
Oh, it's mixed. It's very mixed, which is nice. I like that. It takes away the cultural dynamics.
Right.
Yeah, which can come into play in churches a lot. So yeah, it's quite mixed. And the eldership could be a little bit more mixed, but they are aware, and they are taking it into consideration. Yeah, I like it. Like, I think with every church, there's always going to be, it's full of people. So there's always going to be something that would not. Yeah, exactly. Like, no one's going to be perfect. But what I like about them is that the values and the accountability is very clear. And there are always levels. Like, each person is accountable to someone else. So it's not.
Like every nation, really.
Like, basically, yeah, it's very much like every nation. And interestingly, one of the guys from Every Nation moved to this church because I think they moved house and region in London. So, and I was like, this guy looks familiar. And then Andrew said, "Oh, this guy's at," because he asked me what church I was going to. He's like, "Oh, he's at that church." I was like, "Yes, that's him." I was like, "It makes sense." So yeah, it's quite nice. I like it.
So were you born in Nigeria?
Yeah.
Which one?
In Ibadan.
Okay.
Just where's Ibadan? Ibadan is I think it's southwest. No. Yes, southwest-ish.
Have you been back much?
Did I go last year? No. I went 2 years ago. I'm hoping to go this year.
You're still going pretty regularly.
Yeah, like over the last 5 years, it kind of worked out to be every 3 or every 2 years, which is good, which I enjoy. I love going back. It's, dirty December, as they say. Yeah. Everyone's back from all over, from the diaspora. So it's quite nice.
Like a typical West African country.
Yeah.
And they hike up the ticket prices.
I know. But I use my Avios points with BA. So it's been a lifesaver. Honestly, £3,000 to £300. Like literally, it makes sense. I was like, yes, we'll do premium economy for £300, but not £3,000. We're not doing that just for Christmas. So yeah, it's fun to go back and see. I still have friends back home. I get to see them. I get to eat a lot. I love Nigerian food. It's like my favorite. So I get to eat a lot. And the weather, the weather is the best. And it's during winter when I go, so it's nice to just run away from the dark clouds and the cold and the dreariness and just like have sunshine every day. And even when it rains, it's actually soothing. Yeah, it's soothing and it's nice. So yeah, it's fun to go back.
More, in terms of your identity, you said that you're more Nigerian.
I'm very Nigerian. I'm very Nigerian in the sense that I love Nigerian food. I love Nigerian music. Like, it actually awakens my soul dancing to Nigerian music, Afrobeats especially, and even the old school Nigerian music actually. But in terms of I think in terms of resilience, because Nigerians are really resilient, they are hustlers. I wouldn't say I'm like a hustler, but I would say I don't give up. So in terms of those qualities, I would say I'm very Nigerian. In terms of the mindset, I think Nigerians are really optimistic. So I foster an optimistic mindset for myself. Also, our traditional wear, I mean, I guess people have seen on social media how weddings, the creativity that comes out of Nigerian weddings, the clothes, the outfits, the beading, the intricacy of the work that goes into these clothes it's beautiful to see how a vision comes to life. So I do love Nigerian fashion, and I love our culture. I love our energy. Obviously, there are things that could improve. I feel like Nigeria has so many resources and it's not always necessarily managed very well. Also, a lot of the disparity between the rich and poor still exists quite vividly, and it's hard to see going back, see certain people still in the same place or still struggling with finances or having a steady home due to a lack of governmental resources. There is definitely room for improvement, but we're hoping that as the economy continues to grow, I mean, with the whole petrol scarcity at the moment, one of the hugest, actually, I think he is the richest African. Yeah, he's the richest African man, Dangote. He has a refinery. And we're hoping that if there is investment into the country with businesses that are encouraged to grow and with international use of our local resources and fair exchange for that, that would also impact our communities, our country positively, then hopefully we can see some growth and we can see some improvement. I think that Nigeria has so many possibilities that are untapped. And also you hear about us doing amazingly well abroad in school. Like they're the ones that get scholarships to multi-Ivy League schools. So it's quite nice to know that the talent is there, the resources are there, and hopefully the management of all these things in the future will improve so that we get the best out of our people and we can improve our country as well.
I mean, it's completely off topic, but what is it that, because I've never been to a Nigerian wedding that has been cheap. So they have never spared any expense. So what is it about Nigerian culture? Because I guess you've got the two main tribes, but what is it about Nigerians as a whole that they just go outlandish with the weddings?
I don't know if I can speak for everyone. So we actually have, I think I would say 3, or I hope I'm not speaking out of turn. So there's Yoruba, Igbo, Hausa, from my knowledge,
Right.
that are the main, the 3 main ones. But in general, I don't know, maybe it's just our personality. I think it's in our DNA. We just like to enjoy life. We like to enjoy life. We love to eat and we love to dance. Put everything together in one, you have a wedding. But I think also weddings it's just a beautiful opportunity to get everyone together, to get family together, to get friends, even acquaintances, because you know how the parents love to invite all their many friends to their children's weddings. So it's like a big reunion. And I think the weddings are so extravagant because our vision is so big. Like we don't tend to think things in a minute sort of mindset. We tend to have the most outlandish mindset, I guess. And I think that's a great thing. I feel like it's good to not be limited in your mindset. I feel like when you tap into the impossibilities of life, you can make them possible. And I think that's what Nigerians do. Like they would turn an empty space into a beautiful setting. The decor, the food, the dresses, the outfits, the music. I mean, Afrobeat has grown so much over the last 10 years that it used to be very localized to Nigeria, but now it's worldwide and the need is there. So I feel the extravagance of the weddings or the extravagance of the events comes from a mindset that is limitless. And I really like that. It actually challenges me to not necessarily show off or anything, but to have that kind of unlimited mindset where you don't put full stops in the possibility of creating something that's not been created before. So Nigerians inspire me, and I'm very proud to be a Nigerian babe. Yeah.
Cool. Okay, so there's 2 more questions.
Mm-hmm.
So you mentioned earlier on about mentoring. Are there any kind of projects that you're part of or you're a member of where you promote the mentoring to the next generation?
Yeah, so one of the main projects that I am part of is an organization called Black Female Doctors UK. And it was set up by our president, Anna Kusi. She had the vision. She got the team together and continues to grow that team. And what we do is we unite, we empower, and we inspire medical doctors, dentists, scientists, so including researchers. That includes medical students as well, dental students, or even students that have not necessarily started their journey in medicine or science or dentistry yet. And we saw how we would have benefited from being mentored by, or having access to as well, a wide range of Black female scientists growing up and in our careers. And we are passionate about creating a space where we can foster those kind of relationships to flourish. So we have networking events, we have online webinars where we invite speakers that are already established in their careers to give advice about various topics. The most recent ones we've been doing are webinars in dentistry, where they're having talks about how to get into dentistry, starting a dental practice, careers within dentistry. So we do things like that. We also do community outreach, and we partner with other groups and other doctors that are already established in this area. One of them is called the Community Hub, and it's a doctor called Dr. Catherine. She does an amazing job and basically does outreach where she gives medical advice to people in the community, and she has hubs in different areas of London every month. And she does things like blood pressure checks. We had one where we talked about respiratory conditions like asthma and COPD, which is called chronic obstructive pulmonary disease, and the treatments options that are available for those. And also talking about things like use of inhaler technique, all these things that you possibly wouldn't necessarily have enough time to discuss in depth with your doctors. We were able to cover. Also, one of our greatest achievements as an organization is we created one of the first award ceremonies celebrating female doctors and scientists and dentists in the UK. And we did that, I think that was 2 years ago now. And it was a great success. And it was just nice to recognize those people that are doing the behind the scenes work that we don't necessarily hear of on the news, or that we don't necessarily hear of very advertly, but that they are doing things behind the scenes that make such a huge difference to patients' lives, to trainees' lives, and ultimately to the community. Also, one of the doctors within the organization is Dr. Aziza Sisse, and she's doing a great job. She is a GP, does social media, but also she does a lot of health education around women's health, challenging stigmas, and she appears on the BBC morning show, giving health advice as well. So it's great to just see how members of our community are positively impacting people's lives in so many different settings. And the beauty of social media, the beauty of technology, is that impact is not limited to a specific space, and it can reach anywhere in the world, really. So Black Female Doctors UK, shout outs.
Cool, thank you, Eneh. So just one final question. Tell us one thing that you really kind of like about the EVC label.
So what I actually love about the EVC label is the boldness and the quality. That's what I would say. I think there's such a focus on, first of all, creating unique, beautiful, standout pieces. And those pieces are also created in a way where it's recognizable as EVC. The boldness of the pieces as well. They speak before you have to speak, really, which is nice and is a statement. And I love the use of colors. I love the brightness. And I also love the range, because there are very colorful outfits and there are more nude toned outfits, which works. So everybody can have a bit of what they want and what they prefer. So it's not restricted. Also, what I love is the beautiful lining. You're always going to be surprised by the lining because you just don't know what you're going to get, but it's always beautiful. And I think the contrast in the lining, like in the jackets, in the dresses, it just adds another depth of intrigue, another depth of sophistication and quality, because it's not just a standard lining that you have when it comes to EVC. You have quality lining, you have bright lining. People can see a jacket from the outside, and then you take it off and they're like, oh, I was not expecting that. And I think that's quite unique to EVC. I think something that I should continue to be part of the label. Also, I love the structure and the fit. I think the structure of the dresses are very pro female form, which is nice. And it's not restricted to a certain body type. It allows flexibility for either size range. I think my favorite thing about the brand definitely is the boldness and the uniqueness and the quality. So yeah, well done. Keep going.
Awesome, Eneh. Thank you so much for your time.
Welcome.